Welcome back to another Talking with Doyle with State Representative Doyle Heffley. And today as a guest we have State Representative Valerie Gaydos of the 44th Legislative District in Allegheny County. What are we talking about today, Doyle?
This week we are going to be talking about healthcare. And healthcare as it encompasses like every aspect of healthcare, whether it be prescription drugs, whether it be dental insurance, whether it be Medicaid reimbursements, and a little bit of everything and what's going on in our healthcare system and what some of the policies that are being pursued right now by the far left progressive movement here in Harrisburg. And they don't always equate to good policies when it comes to running hospitals, managing hospitals, and expanding access to care. And I'm joined today by Representative Valerie Gaydos from the 44th Legislative District, which is Allegheny County.
Thank you, Doyle, for having me on here.
Well, I'm glad to be here. And we work together on something. I guess we'll start off talking a little bit about PBMs and prescriptions. We hear a lot of people talk about prescription drug costs and some of the things that are affected by, the high cost prescription drugs. And then we also hear a lot about from our pharmacies when a local pharmacy or an independent pharmacy closes, especially like I represent a very rural district, Allegheny County. I think you're a little bit more populated than we are in Carbon. But when you're driving, a half hour to 45 minutes just to get a prescription filled in a rural county, that really cuts back on access. So PBMs, Valerie, I authored some legislation to provide transparency, but you've been working on some additional legislation this session. Just mention a little bit about what are PBMs and how does this whole system tie into keeping our independent pharmacies alive and well in our communities?
Sure. Pharmacy and healthcare and medication management is becoming more and more complex every single day. And a lot of this is to deal with the reimbursement policies and providing prescription drugs. So the pharmacy benefit managers, which are PBMs, they are the middlemen. They are the middlemen that were initially designed to reduce the cost of medications to make it more efficient. And I think over the past 50 years, it has actually become more and more complicated so that it has almost driven up the cost of pharmaceuticals for patients.
Yeah, and what we're seeing is a lot of times PBMs, and there's only 3 PBMs. And so a few years ago, the state went with an MCO, managed care organizations, to provide those benefits to people that are on health insurance. And it's not a bad thing, right? I mean, MCOs are not good or bad or whatever, but it is a way to manage, because the state has to manage costs. It's one of our fastest growing line items. It's human services and Medicaid and healthcare costs. But the PBMs they step in and fill that role. And one of the things that we've had issues with is reimbursing the cost of prescription drugs to the independent pharmacies that are filling those prescriptions at a lower level than what it actually costs to fill those scripts. And that really put a pinch on our independent pharmacies, and we need these pharmacies in our rural community. So say you get a sinus infection or an ear infection or anything, and you go to your doctor and he writes you a script and they call it in and you go pick it up. That's what we're accustomed to. If you don't have that small independent pharmacy in your community, you're going to have to drive farther, and transportation is a big issue throughout Pennsylvania. And the other part of it is, that if you're going to do a mail order, I'm not opposed to it. It's a cost savings. However, you could wait a week, if not longer, to get that prescription filled, and sometimes you need it right away, especially maybe you have a child with a fever or something like that. So we want to make sure that we have access to it. PBMs, good, bad, indifferent, there's an issue with it, and transparency is a big part of it.
Well, just remember, too, is that there are the 3 top PBMs that control 80% of the market. There are a number of other PBMs, so this is not to put disparity on all PBMs. It's just that when you've got 3 of them that control 80% of the market, that's not the free market. Mm-hmm. And I believe in the free market as a way to actually reduce the cost of anything, not just prescription drugs. So that is really where our issue is that 3 of the largest PBMs control 80% of the market, and what they've been doing is steering patients into their PBMs away from the independent pharmacies. And that's where we have the problem where in small rural communities, like as you said, that people have to drive many miles to get their prescription drugs. And that is creating a lot of problems for healthcare.
Yeah, and we had provided legislation to provide transparency and oversight from the Department of Health But they have not. We've created that ability for them to view these, but they have not filled that role and done their job. And now we've been working on additional legislation I know you've been involved in to try to make sure that there's transparency, shining a light on it, making sure that it's managed properly and that it's fair to all the players.
Well, you took your bill a couple of years ago, took a really good first step to create some transparency as well. And then in 2019, I created a bill that was House Bill 943 that lifted what was called the gag order on pharmacists, because what they weren't allowed to tell you is that if they paid, if you as a customer paid cash, the cash price could actually be cheaper than what your copay was. And they were prohibited from telling you that and being transparent about that. So that was what that bill did in 2019. Now we're taking another bite at the apple, so to speak, to try to create more transparency at the government level. But this time, we're taking a stab at getting the insurance department to make the prices much more transparent and conduct these audits, which, by the way, in 2016, there was legislation passed to have the department do audits, and it's just not being done.
Yeah, and that's the sad fact. We work on legislation to get things done. We identify a problem. We want to make corrective action. And then when the department, the governor's office oversees those departments, fails to fulfill their role and do their job, it makes for more complexities. And at the end of the day, it's the patients, it's the people in the community that need these services that suffer. But aside from that, and that's one part of what we're dealing with right now in healthcare, because there's so many facets. If you look at, I chair the Human Service Committee here in the State House, and some of the things that we deal with, intellectual disabilities, addiction, behavioral health, it's 40% of the budget between health and human services, and that's one of the fastest growing costs in state budgets.
It's huge.
So, but you want to make sure people have access to good care. And one of the things that we've also has been really affecting healthcare recently is the overturning of something called venue shopping. So back in the early 2000s, venue shopping was a huge issue in the state of Pennsylvania. What happens is somebody would get a medical claim. And they would, so say you live in Allegheny County, or say you live in Beaver County or Elk County, and they wouldn't file the claim in that county. They would take that claim and file it in Philadelphia, because they were looking for a particular type of jury in Philadelphia County that has historically been awarding some of the highest payouts in medical malpractice claims. And what that did at the time was it drove up medical malpractice to the point where many doctors were actually fleeing this Commonwealth. And then there was legislation. Actually, Ed Rendell worked on it. It wasn't a Republican or Democrat. This was a thing that they come together and they came up with a plan to stop the venue shopping. Recently, the Pennsylvania Supreme Court overturned that, and it has had a devastating effect. And we're seeing the onset of it right now with the 77% increase in medical malpractice lawsuits that are being filed in Philadelphia. And as these claims, as the awards come out, it's really going to drive up healthcare costs. And that is just going to have a tremendously negative impact on healthcare and access to healthcare across this Commonwealth. When I talk to our hospitals, when I talk to the docs that are there, I mean, we've seen in Carbon County, we've had 2 brand new hospitals being built. Lehigh Valley and St. Luke's health networks are competing. It's wonderful. Competition brings out the best in everything. But yet we still don't deliver babies in Carbon County. And
why is that?
because to have an obstetrician, to have a neonatal folks on staff, it's so expensive, and a lot of it is because of liability insurance. I would love to see every county, minimum every county in Pennsylvania, have a maternity ward where babies can be delivered. We need more
Absolutely.
babies. When we talk about maternal health, we talk about maternal outcomes. When you're driving an hour to an hour and a half to a delivery room, that's not going to help to grow families and to help women's health here in the Commonwealth. This venue shopping is going to be devastating as we look at hospitals that are looking for avenues to increase the maternity wards that we have in our Commonwealth. Things like this, venue shopping alone, is a huge detriment. And recently, we've seen some of our colleagues, some of the more progressive members, the far left, so to speak, come up with all kinds of legislation to give out, free kits when every woman leaves the hospital, and everybody gets this and everybody gets that, and expand all this coverage. But at the end of the day, they're still not providing adequate reimbursement rates for Medicaid. And they're still not doing anything to increase maternity wards across the Commonwealth. And I spoke about that on the House floor in one of those votes.
Well, with that particular vote, I think nobody disagrees that we do have to address our issues with healthcare in all levels. But I think that just passing out free blood pressure cuffs or free lotion without income limits, it doesn't solve the problem. And, this is where we were talking about earlier, is that throwing money at something isn't always the answer. And that's one of the things that we keep seeing with the left, is that they constantly throw money at something when they're not really finding the root of the problem. Mm-hmm. So I think we all agree where the issues, whether it's in education, whether it's in healthcare, or whatever topic it is, throwing money at it is not the answer. And I think that there were a couple bills that I worked on recently, which is, we talked a little bit about the dental coverage, and when, I guess it was a couple of administrations ago, they cut Medicaid coverage, cut dental coverage that was covered under Medicaid. Yep. And what we did see is that we rise in additional health costs because of additional health problems that occur when you don't have good dental care, let alone affecting people in the marketplace for jobs, women especially. If you don't have good dental care, then you're not eating well, you're not taking care of your children, you're not. And so what we found is that restoring Medicaid coverage for dental care, or covered dental care for Medicaid, will hopefully lower costs. I mean, that's where spending should be made.
And I think as conservatives, we want to make sure that if we're spending public resources, we're spending them effectively, and that we're getting the biggest bang for the buck. And when I see some of these proposals that come out about giving away this, or creating this new program, creating that new program.
With no income limits.
With no income limits. So you're talking about somebody who could be making $500,000 a year, you're going to get all kinds of free giveaways. And that's not what we should be doing. We should take care of if we have people that need these services as a hand up, making sure that they're having access to it, but then making sure we're paying for and providing the services that we already said we're going to do before we go expanding it. We have right now a budget surplus, or if you want to say the rainy day fund.
But that program wasn't even a duplicative. Yeah. I mean, or it was not even expanding something. It was duplicative of something that already exists. That was really where one of those issues were with that particular bill that you're talking about.
And that's the key. And that's, I think, what we're working on here in Harrisburg in a bipartisan manner, is to make sure that we're looking at the programs that do work, whether that be making sure that our local pharmacies are getting reimbursed properly, making sure that our hospitals and doctors can afford the insurance so they can work in the community to provide those services, and making sure that Medicaid is going to pay for things like dental services and use those dollars before we go expanding and creating brand new programs that are unproven to work. And that, to me, that is conservative government.
That's the crux of the matter. Yeah, absolutely.